This is Speaking of Pets podcast, where we offer you up-to-date, science-based, accurate information.
Oh, Gizmo! Good kitty. You're such a good kitty.
And they're looking up and howling in unison.
If it affects pets, we'll talk about it. The Speaking of Pets podcast is sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family. Hey everyone, welcome to Speaking of Pets. I'm Dr. Alice Novotny Jeromin, a board-certified veterinary dermatologist, and
I'm Janet Novotny King. I'm the doctor's sister. I am not medically trained in anything. I'm just a pet owner, lover, and rescuer, and we're here to provide science-based information to you so you can be the best pet owner that you can be. So, Al, who do we have on the show today?
Well, you know, we've had so many viewer questions about eye problems in pets.
Yep.
So I went to Dr. Jen Sheahan. Jen is a veterinary ophthalmologist, graduated from Oklahoma State College of Veterinary Medicine, then went on to do a year of rotating internship at The Ohio State University in internal medicine and small animal surgery, then on to do her 3-year residency in comparative ophthalmology at Animal Eye Care.
Wow.
Despite doing all of that, her main interests are ophthalmologic pharmacology, retinal diseases, and dry eye. And interestingly, the majority of our questions today deal with all 3 of those areas. So we're so happy to welcome Dr. Jen. She's taking time from her very busy schedule to join us today. So welcome, Dr. Sheahan, to the show. Hey, Dr. Sheahan, it's so great to have you with us. We have so many viewer eye questions that we're really looking forward to this. So welcome.
Thank you for having me.
Janet, why don't you start being a cat and dog owner?
Being Joe pet owner, right?
Yeah, that's right.
Okay, so how do I know if my dog or cat has an eye problem? Because, you know, we're always looking into those dreamy eyes, right?
Yes. So, you would think that the number one thing they do is they just sit there and whine and, but that's not necessarily some of the signs that often they exhibit. So sometimes they're more lethargic. Glaucoma is seen in people. So we can extrapolate what people feel because glaucoma is quite common in dogs. And so when people have glaucoma, people complain of a migraine headache. Okay. And so we need to be sympathetic to that because when we diagnose glaucoma, oftentimes, you know, they're like, oh, your dog doesn't seem in pain or my dog's just not whining. But that's not necessarily the right question. Sometimes they're like, oh, we thought Fifi was sleeping more because she was just old, but it's because it's migraine headache. And the more you move, the more painful it is. So they interview people and they say, how are you feeling with pressures of 40? And normal pressures are less than 25. And they will say, oh my gosh, I'm in the emergency hospital vomiting from a migraine headache. It's so painful. So you definitely want to, give pain medications and address that because sometimes you, can get around a little better with pain medications. So lethargy, sleeping more. I had a client that said that their dog went to their lap and put their, put their little head on their lap. Mm-hmm. Don't just sit there and whine and complain. They don't. It's just, their eye might be more bulgy compared to the other one. So if you want to always look at symmetry, okay, they can't necessarily always tell you. It's like a little baby. So you have to use your eyes and then be like, oh, like one eye looks a little bigger than the other. The other sign is it's tearing more. So if I poked you in the eye, one eye is going to tear more. And it's like, oh, why are you crying more? Do they really cry? No. Due to emotion, they don't, but they do cry. Or what's actually happening, it's called epiphora. So when you have stimulation from pain or a corneal ulcer or an abrasion or an ingrown hair, they tear more from that side and you're like, oh, it's more wet on that side. Or the other term that you might see on your medical records is called blepharospasm. Blepharospasm means kind of just like fluttering of the eyelid. So blepharospasm, tearing, bulging, redness, change in color like cloudiness or redness. Those are all kind of some signs. And you just always, there are times where both eyes go bad, but there are some times where one eye goes bad and then the other. Like glaucoma, typically if it's primary glaucoma, usually one eye goes and the second one goes in 7 months. Inherited glaucoma. So it's an inherited issue, right? If you have bad knee, it's going to go in the other knee. But traditionally, it's one eye, and then based on papers, the second eye goes in 7 months without prophylactic treatment. With prophylactic treatment for primary glaucoma, it offsets it to 32 months from when the first eye goes. So you want to look at that one is more bulging, is the layman's term that we call it ophthalmic. So
isn't this what Ann's dog had?
Janet's friend adopted a black lab that had one eye enucleated, which we're not sure why. But then the other one started, like you're saying, Dr. Jen, bulging and every day worse. And then it was a tumor back behind that good eye. So, and it was very aggressive. Now, but going back to glaucoma, are there certain breeds that are more predisposed to have glaucoma?
There are. So we have, just like in your dermatology world where you have, for example, your dermatology world, you're like, oh, VKH in dermatology, it's usually the winter breeds like Akitas or Siberian Huskies. So we also in ophthalmology land have, we call it poster children, right? So that, so glaucoma, back to your question, we have chows, beagles, basset hounds, cocker spaniels, shih tzu, Boston terrier, and it's an issue with an inherited genetic defect, and the medical term is called goniogenesis, where when you were born, you have parts in your eye. One part of the eye makes the fluid in the eye. We always explain it like a faucet and drain analogy. So your faucet's always on, and that part of your body is called the ciliary body that makes fluid in the eye. And then you have a drain. But the issue with inherited glaucoma is your drain is just little small slits, small little holes, or sometimes there's no holes at all that drain the fluid in your eye. Whereas a normal dog's drain is giant slats, just like the side of your street. Okay, so the faucet's always on, and then you have your drain, and the drain is actually at the base of your iris. So the color part of your eye, you have all 360 degrees around there's these like draining angles. And so dogs that have genetic glaucoma, primary glaucoma, they have just like little small like pit flow holes. And so usually at mid-age dogs, they can't keep up with the faucet always on, and then their eye starts to swell, and they're like, something's weird in my dog's eye. It's expanding. She can't see from that side, and you're having a glaucoma attack.
I can't imagine the pain that they, and they don't complain. We as humans would complain, but like you said, they might come and put their little affected area of the head on your lap. So sad, it's.
I've also seen though dogs, if they have like itchy eyes, they'll rub against the side of the couch. Do you know what? Like their eyes, like you can see them dragging it.
That's usually my department.
But that's something that a pet owner, something's wrong.
No, I agree, and that can also be an ear problem too.
Right.
You know what I'm saying?
Yeah.
Dr. Jen, when I was doing my residency, it was at a dermatology and ophthalmology clinic. And I think that's a great marriage, those two specialties. What always fascinated me is when you all were looking at the retina behind the eye, you could pick up internal medicine diseases. Would you talk about that a little bit?
Yeah, I mean, it's true when they say the eye is the window to the body. We see so many cases all the time. We just saw one yesterday. A golden retriever came in, and they just came for this non-healing ulcer. And superficial ulcers are, your cornea is one of the fastest healing tissues in your body. Just like when you bite your cheek, your cheek's not still hurting like 2 weeks later. It's like, oh, like nothing happened. So that tissue is very forgiving. So the cornea is same. Like if you have a superficial, uncomplicated ulcer, that corneal ulcer should heal within 72 hours. So we have this golden, it came in yesterday, and then it had this like non-healing ulcer for a whole month, right? So when you go to an eye doctor, we don't just look at the thing that's the complaint. We go front to back, and look at both eyes, because you got two, might as well look at both. And you pick up on things that you don't necessarily, that's not what the client came in for. So this 10-year-old dog, golden retriever, we saw uveal cyst, okay? And then we also saw in the back of his eyes that he had hemorrhage in his retinas, okay? Wow. Not only in his bad right eye, but in his good, non-complaint left eye. And the left eye actually had more blood. So there was like no visual complaints. We don't know. It looked like a fresh bleed. Fresh bleeds are bright red. Old bleeds, just like people, they're kind of like darker in color. So when you have these things that we see in the back of the eye, for this case, we investigate further. We're like, does it make sense? Does it not? Do you have any other health issues? So this dog had kidney disease. So when you have kidney disease, the kidney tells the body, hey, I'm not, I'm kind of shutting down. I am degenerating. Please turn up the pressure systemically to perfuse me better for me to let me do my job. So it's this like vicious cycle. You give high blood pressure to help the kidney, but then, you, as a result for compensatory changes in your body, you can get bystander damage. Like you can get, strokes in your brain. You can get high blood pressure, because you're turning the faucet up. And so you have very fine blood vessels in the back of your eye and your retina that help you see, and those pop. Okay. And so we're like, oh, it's probably related to your early kidney disease. Has anyone ever checked your blood pressure? And you would think, like, oh, I go to my human doctor and the first thing they do is check your blood pressure. But that's very, very uncommon. They go to the dermatologist. How often does your nurse check a you don't, unless you have a complaint? So, and they're like, well, they did it under anesthesia. They did it with the teeth cleaning, but they're already under anesthesia. That's artificially low. It's like a pure standard, go in before you're being stressed out, take a blood pressure. So we took a blood pressure of this dog and it was 260. So normal, it's just like with people, it should be 130, 140 if you're trying to scratch somebody's eyeballs out and bite somebody and be really scared. We give you points for that, right? Because, so, we think 170 could be up to 170 could be a stressor. So 260, on a really, just the golden retriever is just laying there,
like they do.
Yeah, super. I've never met a mean golden retriever. We're like, oh, you have systemic hypertension. It's causing bleeds in your eye, probably from hypertension, probably from the kidney disease. And then at that point in time, we refer them to an internist to do chest x-ray and abdominal ultrasound. And you're like, well, why are they looking there? They want to evaluate the architecture of the kidney. I actually referred one to an internist because we are married to internal medicine and dermatology, and it branches, yes. Right? We're like, hey, this dog has a systemic issue higher upstream, and it's affecting the smaller organs. My eyes are getting affected, and my dog's going blind. Can you probably try to help me fix the upper thing upstream, right? So, because that can help me keep my vision so my dog's eyes don't fill with blood. So basically they look in the abdominal ultrasound and they're like, no problem. So they go in, when you go to see an internal medicine doctor, they then ultrasound the belly. And in this, in a recent patient I did, the internist actually was like, did you know your patient only had one kidney? I've never heard that before. And so that one kidney was working twice as hard, but as age goes down, you can't keep up, right? I was like, wow. And it's not because I donated it to Thailand or some, it just never fully formed. It had this one kidney and the other one, but you don't know unless you look. Like, how often does your dog go for a workup for internal medicine until things happen? And it just like in people, right? We assume all of our kidneys are fine and look normal. So, hypertension causes bleeding. And then, there's other things that we see. We see diabetes affect the eye. They cause diabetic cataracts. You can get lipemic aqueous, where if you eat a big fatty meal, a huge hamburger, like, we wanted to celebrate. We gave my dog, a ginormous, like, Five Guys hamburger. And I turned white the very next day, where the eye filled with, and they go blind, and it's a type of inflammation. Yeah. So you just want to be careful. What you do to your body can show up in your eyeballs and other organs, and it's just like in people. So,
when I go, it's funny because when I go to my yearly ophthalmology appointment, I always say, "How do those retinal vessels look?" Because I'm so worried that it's going to be like the old cream of tomato soup, which means high lipids. You know what I'm saying? But Jen, I have to tell you, I work locally with our Golden Retriever Rescue Group. We have had a couple of Goldens with one kidney. And I don't know if it's a breeding thing around here because they do a lot of Amish rescue, breeding and puppy mill dogs here. But yeah, actually one of my employees adopted one with one kidney, and the mother of that dog had one kidney. So yeah, it might be even a regional thing. Who knows? Hey, you know what would be a good tip? If you have to put eye drops in your pet's eyes, make it a treat occasion.
Like Blue Buffalo's health bars. They're pumpkin and cinnamon. Boy, Libby loves them. So you know what? Let's take a break and thank our fabulous Blue Buffalo sponsor.
Hey, did you know that Blue Buffalo makes prescription diets that are formulated by animal nutritionists and veterinarians? And they're used for dietary needs such as kidney support, gastrointestinal support, weight management, and our favorite, allergy and skin problems.
They make a food allergic diet that's an alligator-based called NP, or a hydrolyzed salmon-based for dogs and cats called HF.
So please, ask your veterinarian about Blue Buffalo prescription diets.
Hi everyone, I'm Larry. Some of you know me as Grandpa Larry. And I run Larry's Animal Safari on YouTube, where we share sweet and educational videos about baby gorillas, zoo animals, and the amazing teams who care for them. If you love animals of all kinds, I'd love to have you join us. You'll meet little ones like Jamila and Kayembe, learn how zoo families grow, and enjoy real moments that bring joy and curiosity to animal lovers everywhere. Just search Larry's Animal Safari on YouTube, or click the link in the show notes. New videos go up weekly, and each one supports awareness for animal care and conservation. Thanks to Speaking of Pets podcast for all they do. Now, let's get back to the show.
I wanted to ask, I was telling Janet, first of all, I know your undergrad was biology, and Janet, I didn't tell you this, criminology. So I was watching a crime show, and you can kill someone giving Visine orally. So tell me why you shouldn't use Visine in a pet's eyes, not orally.
Or give it to your human partner on a regular basis.
That's crazy, right. Yeah. So, I mean, Visine just causes like vasoconstriction and covers up the sign, honestly. It doesn't really treat the cause. So oftentimes,
because people reach for that. They go to over the counter. Oh, my dog's eye he's blinking. So they pick up Visine, and I'm like, no, don't do that.
Yeah, it just covers up the signs. It causes vasoconstriction, so it's not as red. So, but it's like you have to listen to your body. Why are you red in the first place, right? Mm-hmm. So I'm having these abdominal pains. Like, okay, I'm just going to keep taking aspirin. Like, do you have appendicitis? Is your appendix about to right? You don't want to just like, if it's not going away, you want to listen to your body. And, I mean, I think that is fine for like people who are like, I have work the next day and I need to look presentable. But I think when it's really red and it's something serious, they turn red. Your body has these like red flashing signs for a certain reason. Like, do you have pink eye? Are you going to transfer it to your partner? Is that why your eye's red and you don't want to be like contagious and shedding everywhere? So that's like, you want to, and this happens in GP as well. I was just talking to a general practice vet, and they're like, this dog has red eyes, and I gave it BMPH, which is an antibiotic hydrocortisone. And I was like, oh, okay. And they're like, it just like keeps coming back. And I was like, well, that's not really normal. And BMPH is like one of the steroids possible, right? So I was like, okay, have you ruled out the causes? Instead of treating the symptoms, which is a steroid, and everything makes things better that is a steroid, right? But it's like, oh, okay, why are you having these flare-ups, and why does the red keep coming back? Like, are you allergic, or is there something more sinister going on, or do you have high blood pressure, right? We talked about the color red.
Right.
I said, just break it down. Like, there's 3 main eye tests when you go see the eye doctor. It's called a Schirmer tear test to check for your tear value. Normal's at least like 15 to 60 seconds, but 15 is like bare minimum. It's like still barely driving your car, but you should probably it's in the red. You should buy a rating where you're like, put. And then this one is called tonometry. And it's just like when you go see the eye doctor, they puff your eye, okay? But this one, they kind of use a little probe when it pings off your eye, or a little gadget where they put pressure on your eye. And it tests for glaucoma. So that one is less than 25 is normal. And then the third one is a fluorescein eye test. These are very benign, simple, gee whiz, like no big kind of tests, where they put a green dye in your eye and then check for ulcerations, tear breakup time, abrasions, that sort of thing. So I was like, okay, have you done all the tests? And they were like, oh, okay, well, it looks like there is, some sort of liquid in the eye by looking. And I was like, that doesn't mean anything. Your car's driving, so you must have enough gas. Like, you don't measure it, right? Like, are you going to wait until you're like, put? Oh, I guess I don't, because my car was still like moving. So it turned out the dog had like 8 and like 10 on tears, okay? And normal's at least 15, 60 seconds. So this dog had dry eye and secondary keratitis, which is corneal redness. And then they were putting steroids on it just to make the redness go away. Your tears continue to drop. And the danger in that is if you are, one of the holy sins is if you get an ulcer, you cannot be on a steroid, because steroids impede healing. It tells body, back off, don't be red. Go away, like just mask the signs, right? Which is good in some sense, right? Certain situations. But when you have dry eye, if you think logically, your cornea is so dry, it makes little cracks, just like my skin makes little cracks. And there's bacteria that like, oh my gosh, look, guys, there's a breach in the hole, and we should go and jump in and start eating a hole in the eye. And your eye's like, jump. Oh. And so you can get a hole in your eye within like 24, 48 hours because when you're so dry or your flora is not normal, just like in dermatology, you're like thrown off by a massive growth of yeast, and you get more nasty infections because it's the pH or the, whatever that situation is not normal. It's more acidic, more yeasty, more whatever, like more heat. So when you're more dry and your tears have natural antibiotics in them, growth factors, natural like things, kumbaya in the eye, you get corneal abrasions, and then the bacteria can eat a hole in the eye. Then you're on a steroid that was masking your signs when your body was telling you, I'm red because I'm like bone dry. So it's important to not just take things that will mask the signs. And if it like doesn't get better and like, just go see a doctor. But I get it if you're like in Alaska and you have like nobody within like super far, like don't be just constantly doing it, because it could actually be making it worse and your body could tell you something, just like in people.
Well, and dry eye, I remember I would get skin cases in, and the skin was not a problem, but I'd see their eyes and I'd say, when did you last go to your veterinarian? Did they let you leave the office with your eyes looking like that? I mean, talk a little bit about dry eye, which you just sort of did, but dry eye, isn't it usually treatment forever?
Yeah, so the cause of dry eye, just like in people, is a low-grade autoimmune condition. And it also is due to age. You know, as we age, we have less collagen, we have less bone, we make less tears potentially. But the number one cause is autoimmune, and the treatment's very similar. In people, they treat with restasis, which is cyclosporin. And funny enough, which is a T helper cell suppressor. That shouldn't freak you out because it's localized, okay? It's not systemically. So I'm on restasis myself. I have dry eye. I'm like, I didn't have, like, why do I have dry eye? And my doctor's like, well, you're older. Okay, number one. And then
always use that 3-letter word. You're old and you're aging.
Yeah, it's like, oh, okay, that's fine. I was like, I was 20 and I didn't have dry eye. No, I feel like, it's sandy. It's kind of itchy. So in dogs, we give what's called Optimune, which is commercially available. It's like this cream. But, I personally like to use a medication called, it's also called cyclosporin or tacrolimus. And those are aqueous based, so it's a little easier. I don't know if you've ever put cream or ointment in your eye, kind of blurs your vision. And with dry eye, it kind of makes it more gritty, more hazy. So I don't like using ointment if I have the choice, because it kind of blurs your vision even more. And we're trying to maximize vision. It's easier also to give eye drops for ease, last longer, less greasy. So I prefer the drop form. But it's autoimmune, and it takes 2 to 3 weeks for this medication to reach plateau. So oftentimes, if you don't have a renal ulcer, then we want to not just check your tears in 2 days. You're not going to see response. It takes time for this medication to reach plateau. So in our patients, we don't recheck them for 4 to 6 weeks. So we say, go away, come back in 4 to 6 weeks. So don't be discouraged. That's like, I've been using this med for a week and I don't see improvement, because it's still chugga, until it like reaches maximal effect.
Right.
In GPs, they're like, oh, it went from like 8 to like 10 in a week after I checked it. I was like, why are you checking it? Like, it still hasn't reached maximal effect. That's not how the medication works. The only reason we see them sooner is if they have a corneal ulcer, that we have to be checking that at the same time. Mm-hmm. So usually 4 to 6 weeks is when we, where it's like, okay, if there should be maximal effect at 2 to 3 weeks, let's give you an extra time so that in 4 to 6 weeks, there's no question to be like, maybe the medication hasn't had enough time to work. So that's usually when we recheck you for dry eye. And if you stop the medication, on my medication labels, my nurses always laugh, because then there's no confusion and there's no user error. There's no communication error. I always say 1 drop in both eyes twice a day forever. So then,
that's smart.
Forever.
Yes.
That's smart. As a pet owner, I appreciate that.
Right.
When I'm done with the bottle,
Yeah. I didn't know I was supposed to continue it.
Yeah, or forever. Don't forget to renew before you run out. You know what I mean?
Yeah. So there's no question.
Jen, you said something very interesting to me, and Janet, you'll be interested in this. I hope I get it right. When I was listening to your webinar with Dr. Lee, you mentioned when you give 1 drop, don't give like 2, 3, 4, because of the capacity for the eye to absorb a certain volume.
What do you mean 2, 3, 4?
Well, she'll explain it. You get what I'm talking about?
Yeah. So there's 2 factors. Okay.
Okay.
So, most of these medications are the same medications that they use commercial human pharmacies, human eye doctor clinics. And so they're pretty smart, right? The pharmaceutical companies, they got it figured out. So there's 2 factors. So you want to make sure it's proper administration, where it's not like, oh, I'm not using it correctly. My dog's not responding. So the first rule or thing to follow when you give eye meds is your eye only holds 32 microliters, okay? And so each drop that comes out of the bottle is 36 microliters per drop, okay? So they have it figured out. I mean, they're not dum-dums like in a pharmaceutical company. They already compensate for overage. So it doesn't really make sense to do like, oh, I put 3 drops in per dosing, because it's just going to go onto your face because your lacrimal bleed, okay? So number one, so it doesn't make sense when it says like 2 drops 3 times a day, 2 drops per sitting. No, because you're wasting your med. And then it's like silly when it's like, oh, you just got this medication on Friday, but it's like Tuesday and it's like empty. Like, why is that? Right? So that's the first thing. And then it's important to wait at least 5 minutes in between eye drops, because your eye only sucks in 1 drop every 5 minutes. So 1 drop, and it's like a slow absorbing sponge to like get across the cornea or, absorb. So if you don't follow that rule, then if you have multiple medications, you're like, I'm a busy person. Yes, I'm going to go like, 901 drop, 902 drop number 2.
Right.
Tropicamide, drop number 2. Drop number 1 was at 901, ofloxacin antibiotic. At 903, I give like tobramycin antibiotic drops. So, and it's like, okay, I'm done. They said, these drops in the morning, but if you don't give them correctly because of the rules we've talked about, what's happened to the other drops? So the drop number 2 and drop number 3, and quite frankly, drop number 1 is getting diluted, right? You're getting half the amount because that it hadn't had time to absorb, if you just think logically. And then the second one is just kind of falling onto your face, and you're like, my dog's not getting better, and I spent all this money on meds. So I think it's important to wait. You can wait longer, but you can't wait less time. So if you want to wait like 9 o'clock, 10 o'clock, 11, I work from home, this and that, then fine, wait longer. But please don't wait less time, because you're wasting your meds and it's not working as well.
I just think that is such important advice. Yeah. I was a pharmacist before I was a vet, and I didn't know that. And I'm counseling people on how to give their meds. I think that's fascinating.
Well, I do have a tip, though, for ointments, because ointments are really hard to get in your eye.
Yeah.
What I do is I take a Q-tip.
Oh, boy. Wait a minute. Go ahead.
Oh, is this a bad thing? Because the pediatrician taught me this. And you put the little bit of the ointment on there, and then when you pull the lid down, and it goes right in.
What do you think about that, Dr. Jen?
I mean, we typically say just try to use the tube itself. And, because sometimes depending on the condition, you don't want extra things going in the eye. It's just like balancing act. Like, okay, that dog, you can ask your husband to sit there and be like, I'm going to use this Q-tip and pull your eye open and do the thing. But your dog's not going to be like, so where's
I don't know, my golden might be.
Right. Where's your third hand coming from? Unless you have a person, right? Oh, I'll get Q-tip and I'm going to hold your eye open, and the dog's like, oh, yes, please, Mom. Okay.
Let me put my paw there.
Yeah, exactly. It's just a lot. And if they have like an ulcer that you're treating, if you put pressure with the Q-tip and they suddenly move, then it can act like a foreign object and pop your eye. We've had that before. So oftentimes,
okay, so I won't do the Q-tip. All right, I mean, do it on humans.
If they're really, really good, I mean, you can. But typically, we just say, lift up, and then basically, this is called the fibrous tunic, the white of your eye. So it's more for lift up, and then it's like, oh, it won't come out like a spatula. It's just not coming down.
Yeah.
So you kind of do the amount, and then just like a spatula on the upper lid releases, and then blink, and it creates a shade.
And then you can't see. It's terrible. Al, I was thinking, and Dr. Jen, you might agree, to make that medicine delivery a little more pleasant for your pet, it's probably a good idea to give them a treat. And I know our Libby loves the Blue Buffalo health bars. They're pumpkin and cinnamon, and they smell super good.
So let's take a little break and thank our sponsor, Blue Buffalo, and get those treats.
Blue Buffalo Natural Veterinary Diets offer a natural alternative in nutritional therapy. With their in-house research and development team with over 300 years experience in well pet and veterinary therapeutic diets, more than 600 scientific publications, and more than 50 U.S. patents, Blue Buffalo, natural veterinary diets.
Hi everyone, I'm Larry. Some of you know me as Grandpa Larry. And I run Larry's Animal Safari on YouTube, where we share sweet and educational videos about baby gorillas, zoo animals, and the amazing teams who care for them. If you love animals of all kinds, I'd love to have you join us. You'll meet little ones like Jamila and Kayembe, learn how zoo families grow, and enjoy real moments that bring joy and curiosity to animal lovers everywhere. Just search Larry's Animal Safari on YouTube, or click the link in the show notes. New videos go up weekly, and each one supports awareness for animal care and conservation. Thanks to Speaking of Pets podcast for all they do. Now, let's get back to the show.
So I have the eternal pet question,
And Janet, then we got to wind it up because she's got to go see patients.
Oh, okay.
But go ahead.
Do cats and dogs see color?
Oh,
Yeah.
I gotta ask.
okay.
Yes, yeah, they do see color. It's just in like muted tones, depend on what kind of animal it is. And, like birds have more vibrant color hue. Certain bears have certain color hue. If you're a fibrous animal, like a farm animal, then it's more muted because they just need grass and brown, and they don't
Interesting.
need to like identify an apple or like a shiny banana. So it's very important. It's very interesting, and there's parts in the eye to accommodate for that because whether you're herbivore or carnivore, you have an extra reflective. You're like, oh, I see this like yellow eye shine. We don't have that because evolutionarily, with that conversation, we are primates, so we're not carnivores, so we don't have this extra structure called the tapetum, whereas like dogs and cats do. So when you look at them, they have this like really pretty, it's like a rainbow eye shine, and it's an extra reflective layer that ping pongs in the eye to maximize like light absorption in dimmer light settings when they're hunting, right? Whereas a horse or a cow doesn't have this because they're not hunting in the middle of the night needing to reflect extra light. They're just like chewing their cud,
So you know what? My cats must see chipmunks and mice as hot pink.
What?
My cats must see the chip.
Oh, yeah, because they're
in hot
chipmunkers.
pink, like
Yes.
the color. Okay, one more human question.
All right. Hurry.
This doggy TV thing is like a thing. Is that okay for like their eyes? Is that healthy? Because I know as humans we blink less when we watch screens and TV.
Yeah, I mean, it's if it keeps your pet entertained, and I don't think they've studied it enough to where they're like they do in kids, where they're addicted and you pull away and they go crazy, or they throw tantrums. Like your dog's gonna be like, But if it like you're like, look, I only have an only dog. I don't want him to be lonely when I'm at work for like 4 or 5 hours. Like he'll go and drink and eat his food, but like, oh, I'm learning. That's fascinating. That's absurd. I think there's no harm, but it just like we do in little kids. You don't want to replace that with. You still want to exercise them and interact with them and stuff, not just sit in front of the TV. But I don't think there's harm. Like, hey, when I'm at work, I don't want you to be lonely and just like, what's happening? And I'm just in box. It's like, oh, I put the TV on for my dog. And it's like, that's totally cool that your dog watches TV. Like, just a cat across the TV. I find it fascinating. I think it's cool. But definitely make sure that they're not a couch potato and you still do.
Oh, that's true.
Like just
They're with the clicker.
Yeah.
And a cup holder.
Yeah.
But I think cat TV is fascinating because they have like the can opener noise.
Yeah.
For people that still do can openers, and then birds are flying onto their nest. Cats are like crazed with it. I mean, they're like, it's almost like an addiction.
Yeah.
Well, I had it on the iPad where it was like fish.
Yeah. Yes.
And Atticus was, and he got points.
Wow. That's smart. Enrichment.
Well, listen, we've got to let Dr. Jen get to work.
Wait, one more
can't
question.
thank you
One
enough.
more question, Jen. What is your pet peeve?
Oh, okay.
Pet or human?
So just, I would say, I think it's important to do your research. I welcome questions, but just definitely have an open mind. We sometimes have like physicians, or they're like just very like,
Totally agree.
yeah, they're like, well, in people and stuff like that. I was like, that's very fascinating, like mutual respect and stuff. Dr. Google said this, and I was like, look, it's my job to, inform you from my training and all of this. If Dr. Google says that, I mean, you don't really need me, So just have an open mind. The internet is very accurate. Some of the things are like, oh, yeah, that is true. So just have a respectful conversation in all platforms, like whether we're at the restaurant, whether we're at, ordering food, whether you're come. So, it's always a little like scary and intimidating when you get Karens or whatever that come in and automatically like, it's like, I know what's going on. I need this, it's like, ooh, that's scary. Doctor said this. And I've bred dogs for like 50 years and I know better. Like really big turn-offs that's like the thing. It's like, well, why are you here? As my bubble says, but I'm like, okay, so just kind of be respectful. We're humans too. And it's just, we want to have an enjoyable interaction and help your dog, and we all have the same goals. So just anytime, just like when you talk to somebody at like McDonald's or anything, just everything we do in life, just I'll be like, if you were in those shoes, you want to be like, oh, please and thank you. And we're just trying to help your dog. And this is just my advice. And, I'm just trying to give you my piece of thought. And Dr. Google, nice to meet you, Dr. Google. Dr. Phil said this.
I love that. I'm laughing because you and I, it's the same. It's here's my advice. And then some people fight with you. And I'm thinking, why did you come all this way for my training and everything to tell you the proper thing to do, and then you're going to fight with me on it? I'm just trying to help your pet. Yeah. Well, anyway, Janet, this has been, I could listen to you all day.
Eye-opening.
Yeah.
I love the drop thing and how long it lasts and only to use one. I'm still hung up on that. I think it's wonderful information. Yeah.
I learned a lot.
Yeah.
Anyway, Dr. Jen, thank you so much. This has been such a pleasure. Janet, you have to admit you've learned a lot.
A lot.
Yeah, well, you guys are great, and it's been a pleasure. Thanks for doing what you guys do, and if you guys need advice or help or anything like that, we're here for you. Or if you have any veterinarians that need advice, they can look us up, Veterinary Clinic, and we're happy to consult, even though we're in California. And we're here for pet parents. And, it's a beautiful profession that we're in, because animals don't have a voice. And no matter what specialty or, GP you're in, we have to represent them. And this is what they're trying to say. Their paw hurts. Is there something stuck in there? And I think it's like, they're always innocent. That's kind of why I went into veterinary medicine versus like, human medicine. And if I did go to human medicine, it'd probably be pediatrics, because they're always innocent and they're very like, just, you're their voice for them. And it's just really great what we do. And animals are just, pure hearted and wonderful. And I love what we do. And, it's the circle of life, and it's great.
And the one thing I love about our profession is we're here to help, and we help each other. And I never met Dr. Sheahan before. And look she agreed to come on the show. I mean, it's just, it's such a giving profession. And I love us for that. Yes.
Thank
you.
Well,
Janet, let's wrap it up.
Okay.
So this is Dr. Alice Novotny Jeromin from Cleveland, Ohio, and
Janet Novotny King from Cleveland, Ohio, saying thanks for listening. And don't forget to share with your friends and give your pets an extra treat for us. Thanks for listening. Bye-bye.
Bye-bye.
Thanks for tuning in today. We hope you learned some valuable information about making decisions about your pet's health.
And don't forget to follow us on social media and subscribe on podcasts, because we love to have those likes. Thanks so much for listening.
That's actually really good.
Oh,
you could both go bye-bye.
Bye-bye.
Yeah.
How about woof woof?
This episode of Speaking of Pets podcast was sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family.
Follow us on social at Speaking of Pets and listen wherever you get your podcasts.
The Speaking of Pets podcast is an SLA video production.